So this is some information about the choices that you have about how and where your health record is shared between health services who are involved in your care.
Okay, fine. So what are the choices?
So there's two choices that we're talking about. One is the summary care record with additional information.
Good.
Which is a national IT system and includes a subset of information from your GP record.
And who would that be available to?
So that would be available to clinicians who are involved directly in your care.
So assuming I go down to the West Country, which I do quite frequently, and I had an incident, would they be able to access that summary record or not?
So if you went into an NHS facility and you saw a clinician, they would be able to access your summary care record with additional information should you have chosen to share it.
So it's UK-wide? Or is it England and Wales wide?
England and Wales.
England and Wales.
Yeah.
So Scotland and Northern Ireland have a different system, do they?
I'm not aware that they have a summary care record with information.
Okay, let's crack on to the full bit, which is a bit that I have reservations about.
Okay, so the full health record is the choice that you have as to how and where your full health record is shared using the IT system, which is System 1.
Right.
So the choice so again, this is the GP record.
Right.
And we all would have a GP record, so the GP surgeries in Felixstowe use an IT system called System 1.
Right.
And if you choose to share your record, that means that your GP record would be available to other services who would be involved in your care.
Right.
For example, if you're under the care of the local district nurses or community physiotherapists or occupational therapists,
right.
and you were being treated by them, they would be able to access your GP record to see, as an example, the medications that you were on, any long-term conditions, sensitivities and allergies, and other information that may have been
right.
in your GP.
So this really should improve the out-of-hours service in that they would have better access to patients they may be called to know what currently is happening, if anything.
So the idea of this is that the information would be shared among those services, so effectively providing more joined-up care for patients.
Yeah. So how secure is the whole system? Because certainly those of my age who worked in the electronics industry does have a deal of reservation about level of security that can be achieved.
So the information that is stored,
which is there,
So the information that is stored is held within an IT system. The IT system is called System 1.
Right.
And that's held within the UK in a data centre within the UK.
Right.
If you choose not to share that information is only available from the staff at your GP surgery.
Right. So they could still get to it then, effectively. If, the hypothetical situation, I'm down in the West Country, I fall into the River Dart, I need treatment, I go to Sarah Wollaston in Totnes, who's quite a good GP, not a bad MP. She could say, I need to contact your home surgery, which would be the Grove here. She could actually still do that through a sort of receptionist to receptionist and do a transfer to find out whether I had any particular pre-existing conditions.
So if using your example, if you did go down to the West Country, a receptionist or someone could make some contact with your local GP surgery,
right.
And with your consent, that information could be transferred securely electronically,
right.
Somehow to down in the West Country. I guess that wouldn't necessarily be done in such a time.
The blink of an eye.
Yes.
Okay, young man. Well, thank you for that. That's clear. Is there a big push for this? Because I'm noticing all over the planet that all organisations now want to be totally digitised and they want to divorce themselves from paper. Is that just a progression of this? Or is it for better healthcare? Well, that's really the question, I suppose.
So for all of the above, really. So a better healthcare perspective, we've got information which is within GP surgeries and the choice that you have as to whether you or not you share that information with other services who are involved in your care.
Right.
So as an example, if I was a patient and I choose not to share my health record,
yes.
If I was under the care of the district nurses, who again might be local to Felixstowe, the district nurses wouldn't have access to my GP record, so they then wouldn't be able to see what medication I was taking, and any contact I'd had from my GP surgery.
All right. So are you now saying that in England all GP surgeries are running compatible computer systems with the mainframe systems?
Unfortunately, not all GP surgeries are using the same IT systems.
No. So do we still have a few non-connectables or not?
So at the moment, there's not full interoperability between all of the IT systems.
Right.
System 1 and EMIS is another locally well-known and used IT system.
Right.
There is work that is ongoing to connect up these systems.
Everybody, yeah.
But that doesn't fully exist at the moment.
Okay. Well, thank you very much. Have a lovely Christmas. And we'll see you in the new year, no doubt. Thank you.